Good evening, everyone. I hope everyone is well and keeping safe. Just getting by and making the most of everything that is happening in this uncertain time. Some of us were in lockdown and it has been lifted, but let's bear in mind that we should try and still keep to those safety measures as much as we can to protect ourselves, to protect everyone around us. On today's show, I'd like to mention that it's one of those things we experience in our life. Many of us go through in various different ways, and it affects us in many, many different forms and situations. Miscarriages. What is it? What happens? How does it even occur? How do we deal with it? Many of us have gone through it. Many of us find it's one of those things that we feel we cannot speak about. But today, let's talk about it with SABIA KHATUN, about miscarriages and the fact that you are not alone. On that note, I will take you over to my wonderful guests, who will be participating and contributing on various different professions and abilities to about what this miscarriage is about and how we can somehow overcome some of the fears maybe related to it. So I'd like to take you firstly over to a wonderful guest who has joined us all the way from India, and his name is Dr. Hrishikesh Pai. I'll just briefly introduce you, Doctor, and then we can go into exactly what it is that you do. But Dr. Hrishikesh Pai is not only a medical director in one of the organizations in India, but he's also a specialist gynecologist who will share some very, very valuable, information with us, and how we can all understand a little bit more about miscarriage. So welcome, Dr. Hrishikesh Pai, onto my show.
Hi there. Hello. Hi. Hello. Welcome.
Thank you.
I bring greetings from India.
Thank you, Doctor. Okay, so I'll go over to our next guest, who is Natalie King. Today, I've had Natalie on my show previously before, but today I have Natalie here who will be sharing some very, very sensitive and valuable experience with her. She is also a confidence expert. So welcome again, Natalie.
Thank you, SABIA, and it's always great to be on your show. And yes, and it's a good way to share my story and help increase the awareness about this topic.
Brilliant. Thank you for joining us again. And then over to my guest, who is from Pakistan. Her name is Fizza Arshed. And I'd like to welcome Fizza Arshed, who is our clinical psychologist all the way from Pakistan. If I can take our viewers over to our Dr. Hrishikesh Pai, who, I believe is in a very, very, well positioned to tell us about and give us an insight about what is miscarriage, just briefly, and then we can go on to a few of the other aspects about miscarriages. So if I can take everyone over to Dr. Hrishikesh Pai, it's already a privilege to have you on our show. So yes, if you can give us some insight, Doctor.
Thank you, SABIA. So the miscarriage, basically you have the patients who become pregnant, and some of them lose their pregnancies. So if you lose a pregnancy before the 20th week of gestation, normally the age of viability is around 20 weeks or 5 months. So if you lose a pregnancy prior to 5 months, in England it is 24 weeks cut off, but more or less in the world it is 20 weeks. So if you lose a pregnancy, that's called a miscarriage. So majority of the pregnancies are lost before 12 weeks of pregnancy. That is before 3 months. Nearly 80% of pregnancies are lost before the 12 weeks of pregnancy, and about 20% are lost in the second trimester. So the first trimester is in the first 3 months, second trimester is the next 3 months, and majority of the pregnancies that are lost in the first trimester, nearly 50% of them are due to chromosomal problems, and 50% of them are due to some other reasons as well. So this is the general classification of miscarriage. And, then there are some sub-classifications, but this would be overall a good definition and good understanding of what a miscarriage is all about.
Thank you very much for that.
Yeah.
Yes. So I'll come back to our doctor. What I would like to do is I'd like to take everyone over to Natalie, who has very, very kindly come on today to share her experiences of miscarriages, and she is more than happy to share the actual situation she's gone through. And so if we can ask Natalie to share with us, we are all waiting to find out and get a little bit of awareness what an actual person actually does go through. So over to you, Natalie.
Thank you. It's I didn't think I'd be so nervous, but I actually am.
You have all of us, Natalie. Nothing to worry about. Just in your own time.
It's not the platform. It's not the talking. It's the story. Because I've never actually spoken about this before. I mean, obviously, close friends know that I've gone through this, but nobody else knows. It's something that is one of those secrets that you keep, and it's something that I feel needs to be spoken a bit more, because it is unfortunately, it is very common. I've had 4 miscarriages. All of mine were within the first trimester. And the one was I just made it to the 3-month scan, and going for a scan and being told that there's nothing there. That was heartbreaking and gut-wrenching. And it took me a long time to emotionally recover from that. But it's having a miscarriage for me, and I'll tell you my personal story, and people are different. Everybody has different experiences. But for me, it was for a few days, it was very physical pain. But then it's afterwards. It's afterwards what happens. It's the grieving that you go through, and you're usually doing it in secret because you don't want to tell everybody about it. Or people they want to be kind to you, but they don't necessarily understand. So they'll say things that actually make it worse. And then you out in society and you seeing kids, or you see pregnant women or anything, these can all trigger you. They triggered me to realize of what I'd lost. And the process that you go through is really difficult, because what you're doing is you're grieving a possibility, you're grieving a future, or you're grieving something that hasn't happened. And it's really difficult to explain it, but it took me years to recover in a way, not just physically, but mentally as well. And I mean, like I said, I've had 4 miscarriages, and the last one just knocked me on my knees for months and months. And I didn't know if I would ever recover.
Yeah.
And that was really hard, but we need to spread the word.
So doctor, we've heard a little bit about Natalie's the number of miscarriages she's had. Are you able to elaborate on why maybe this happens, and the fact that that the number of the miscarriage that she's had, is that normal, or is there a name for that, or is that something that can be rectified? So if you can give us some information on that, that would be great.
Yeah, so she has had what is known as recurrent pregnancy loss, and I first of all I can understand a lot of the patients, they go through a lot of sadness, anxiety, guilt, grief. It's like losing a precious member of the family. And people have to understand that, and that's why the name was changed from in the olden days we used to call it recurrent abortion, but Now we have changed the name to pregnancy loss, because it's that the previous terminology was not very proper, and it used to hurt a lot of people. So that's one thing I would like to say. So people around have to understand that it's a major psychological impact on the person and the husband, as well as nearby family members, and they need a lot of time, they need a lot of support from family, friends around, to get them out of this problem. It's a major psychological impact. Now, people who have repeated abortions, it's called recurrent pregnancy loss. So
Right.
it's more than two in United Kingdom. It is defined as more than three losses, irrespective of, it can be even a biochemical pregnancy. Means biochemical pregnancy is one where your pregnancy test is positive, but in actuality when you do an ultrasound there is no pregnancy, so that's called a biochemical pregnancy. So if you have three or more biochemical pregnancies or normal pregnancy losses, it's called recurrent pregnancy loss in United Kingdom. But in United States it is two losses, but they are supposed to be clinical pregnancy losses. So you have to see a pregnancy on ultrasound, and if there are more than two losses, it is known as recurrent pregnancy loss. So there's some definition, but I
Yeah.
personally feel any two losses is good enough. In fact, even
Yeah.
when the patient has got one loss, they get very hyper and they come and they want you to start investigating them. You can't tell a person that you wait for one more loss and then come to me. So it's very difficult to counsel patients as
Mm.
far as this is concerned. So
Yeah.
there are a lot of
What I
reasons for it.
Yeah, what I wanted to ask on that is these recurrent miscarriages, can they happen at different stages of the pregnancy, like from your first trimester of the first 12 weeks, or from 12 weeks to 24 weeks? Is there a specific timing that it happens, or are we saying that it can happen anytime?
It can happen anytime, but most of the chromosomal related losses will occur in the first trimester, that is, in the first 3 months of pregnancy. But certain conditions like antiphospholipid syndrome, they can have some losses in the earlier part of pregnancy and some losses in the latter part of pregnancy as well. So based
Right.
on the cause and the etiology, the presentation can vary a bit.
Okay, so I'm going to take you all over to our clinical psychologist, Fizza Arshed. Fizza, I'll just briefly let you know that Natalie, who's shared her experience about, the miscarriages that she's had, not only one, but recurrently, about 3 to 4, and what kind of things do you think that she may have gone through, to be able to say, well, am I okay to think that was, the four miscarriages that I've had, are normal, or can I try again? What kind of, mental, emotional things do you think that she could be going through, and people like herself could be going through? If you can give us some information about that, that would be good.
Okay, so all of us experience emotions differently, and in this matter also there could be number of different responses coming from people who experience this at some point in time in their lives. The most common issues that such people face includes a feeling of guilt.
Okay, I think Fizza's frozen there.
Husbands
I'm
with
not.
their better half because they some way or the other believe themselves or their partners at times are not able to understand or empathize with them, due to which they experience number of different numerous relationship issues,
Okay.
disorders that may emerge as a trigger due to this problem that they have faced in their life. Most commonly, post traumatic stress disorder is very common in patients, in people who experience repeated miscarriages. nightmares of the theme of losing their kid, of losing their loved one, and different flashbacks or of that experiences that they had in their life. These are the most common and repeated responses that we have recorded from people who experience miscarriages.
Right. Okay. So, Natalie, could you share with us some of those emotions that what Fizza has mentioned? Are they quite relatable to what you may have gone through? And I mean, have you had a supportive partner along the way? Some people are quite blessed to have that, some people are not so blessed. So are you quite relatable to some of those emotions and things that you could have gone through?
Yes. So I had a miscarriage with one partner, and then I've had two with another partner, and two with one partner, sorry, and two with another partner. And the first partner, he took it really hard. He really struggled with it, and he couldn't cope with my emotions. So I just bottled it all up and just got on with stuff because that's what I needed to do. With my second partner, it was very different. He supported me. He understood, or he allowed me to express my emotions and to actually speak about it. To actually, when I said something that might have not been, you get really angry, and I used to just say things out of anger, and he just understood that it wasn't me being horrible, being nasty. It was just me trying to deal with what was going on, what was happening. And and I really appreciated that, because even now we still sometimes can talk about it. We still sometimes, what ifs, and they would be this old now, and but we can have that discussion because we've been through it together, and there was no barrier put up because we communicated throughout the whole process. And my last one was a quite bad one. It was more ectopic pregnancies, and I really struggled physically with that for a long time to recover. And when I just say, I'm just really struggling, he just said, okay, just take it slow. You need to deal with this. You've been through something really traumatic. You need to deal with this. And he actually helped me to almost take a step back. And when I mentioned to him that I wanted to talk about this and want to start to create an awareness, he was like, go for it. If that's what you need to do, go for it. I'm here to support you. And that does make a big difference, and it really helped me.
Right, yes. So, Doctor, you've heard what Natalie has just shared with us about that. What kind of investigations do you think are going on with people who have had like recurrent miscarriages? And how are things going about it if they would like to try again, for example?
So, you need to understand that in 50% of patients, there is a definitive factor from uh, the patient side. For example, there may be a parental chromosomal abnormality in the husband or the wife. So we normally do a karyotyping to find out if there is a problem. In 15% of patients, you may have a APLA syndrome, which is called antiphospholipid syndrome. And normally we have a few tests like glucose anticoagulant or anticardiolipin antibodies, which we do to pick it up. And there may be a uterine structural defect. So nowadays you have 3D ultrasound, and you can easily find out whether there's a fibroid or a septum. There may be a septum within the uterus, like a curtain, and that can be easily tackled by doing a hysteroscopic surgery and removing it. Or if there's a large fibroid, we can tackle it. And then we look at the hormonal profiles. Many of them are hypothyroid, or you may have a borderline diabetes. So these are the important, and the chromosome. So it's very important for patients to check the products of conceptors. I know it's a bit of a, it's very
Yes.
difficult to do that, But the genetic testing and the new genetic testing that has come, it is called CGH microarray, or nowadays we use an NGS technology, next gen sequencing. So majority of unexplained recurrent miscarriages are due to chromosomal disorders. And if you check the products and you use a high level testing, you can pinpoint that. And if you pinpoint that, then you can easily treat it. So in 50% of patients, there's a treatable cause. Suppose you have got a diabetic, high blood sugar, you can treat it. You have a hypothyroidism, you can give them thyroxine. You have a APLA syndrome, you can give them aspirin with heparin injections. If you have a chromosomal problem, you can test so you can do pre-implantation genetic testing where you do the IVF, and prior to putting the embryo back, you can test the embryo for aneuploidy, genetic abnormality. And in those patients, so nowadays in high order miscarriages, what we do is that we can do pre-implantation genetic testing, even though there is no history of genetic problems either in the mother or the father, or in the products of conceptors in the previous losses. Even in those, we offer pre-implantation genetic testing with very effective. Now, of course, there's another school of thought which says that you don't need to do any of these things. You just need to give them TLC, tender loving care. You have these recurrent pregnancy loss clinics where they take you through the pregnancy, they do repeated ultrasound, they give you psychotherapy. And there's a lot of school which says that instead of doing all these aggressive medical therapies, which I do, you can just do the psychotherapy, give them support, and they will ultimately have a child. So there are two different divergent
Yes.
routes that you can take.
Yes, yes, that's very important to know. Fizza, we're just saying to Natalie that she's had two different partners, and she's had two miscarriages with one partner and two with another partner, and she's had different levels of support. What we would like to find out from you, what kind of other psychological ways this can have an impact on not only the person who's had the miscarriage, but also their partners. Can you tell us a bit about that?
Yes, I agree with what the doctor has told, that most of the times the patient does not really require the rigorous, aggressive medical therapies. Rather, psychotherapies are more beneficial for these patients. Love, care, empathy is very important for them. So, in the relationship, the most common issues that occur is that they are not able to genuinely understand what the partner is going through. They are not able to empathetically understand what the partner is going through. And the partner who has had the miscarriage experiences emotional upsurges due to the hormonal changes and due to the loss they had experienced, obviously. So they become irritable, they become depressed, they become uh, emotionally unstable, which the partner are not able to cope up with, due to which they experience different nature of issues, which could include uh, they're not able to discuss anything with their partner because they believe that the partners do not have that decision making. They're not able to enjoy with their partners. Even their marital life is disturbed because of these issues. So
Yes.
as she has already shared with us that the second partner was very supportive, and she has shared her story. So the second supportive partner had a really positive impact on her, and as compared to the first partner who was aggressive. So yeah, and the doctor has also summed up this, that the nurturance, the care for the patient is very important.
Yes, yes. So, Natalie, as you've heard, our medical directors, facts about, some of the ways that it can be going about. And Fizza here has very clearly mentioned some of the psychological impacts that can be going through as well. Could you care to share with us, the actual process of, the rest of the journey that you went through, and how it actually really did impact on you, so our viewers can get some awareness of, these are some of the things that one can, and realistically, can happen to them, along with some of the support that you could have.
So yeah, it was a long journey. It's I just almost just collapsed into myself. I became very angry, I felt guilty. I questioned everything. I and it took me a long time to almost come to terms with the fact that this has happened to me and the consequences from that, which is I don't have children now. And I did get some counseling. Some counseling was offered to me with the fourth miscarriage, and she helped me to understand that what I was grieving, and I was grieving a possibility or a potential future that wasn't going to happen. But it's also the impact that this had on my my mother and my brother, because my mother was very much wanting grandkids, and it was, well, what's happening. I've never known why I've had these miscarriages. Some tests were done, but everything came back normal. So theoretically, I shouldn't have had these miscarriages as far as the medical tests that I've had. But it still leaves you wondering what's happened. But it's also the long term. It's I became really depressed, and it just kept on going. I would be tearful at times when I shouldn't have, and all of a sudden I would see something and just be triggered I just get really cross or angry or upset. And this took years to almost feel normal again, and the hormone imbalance also just took ages to come right in my body.
Yeah.
As I said earlier, I was physically struggling as well, because I just
If I may ask, Natalie, how long ago have you had these miscarriages, from today?
So my last one was, now you're asking me, I think about 8-9 years ago, and it's taken me this long to start to talk about it. So it has been a long journey to get, because I had the miscarriages quite within a period of 4 years. I had all these miscarriages, and then I made the decision that it was either keep trying or stop trying and have to deal with the consequences of not having any children. And that again is a huge impact, because it's like, well, sometimes I'd say to my husband, I say, oh, what happens? Shouldn't we? But it was a decision that we made, and it was a decision for us. It's not necessarily the right decision for everybody. But then again, you sort of think, well, what if, or maybe, and what would life be like if we had kept going, or anything like this? And you have to live with these choices that you make that are permanent choices. And it was something that even now I still think, well, should I, shouldn't I? It is these decisions that you make. And sometimes quite often people would say, and whether it's just to be kind or not understanding, is, well, you can always try again. I needed to stop at 4. I do know of women who've had more, and I don't know how they've done it. I had to stop at 4 because I felt that I wouldn't be able to deal with a 5th one, and I had to take that into consideration, because of my record, because of having these reoccurring. Maybe the 5th one might have been the charm and worked, but I had to ask myself, could I keep going with all these emotions with everything that was happening, the physical, the mental.
That's very important. Yes, that's very, very valuable. I mean, if I can ask our doctor here, what kind of diagnoses and investigations, do you think are, or can, take place? Listening to Natalie's story about the number of the miscarriages she's gone through, as well as, can you tell us also a little bit about, can IVF come into somewhere along the line there? And before we go on, maybe you can also touch upon this. What does hysteroscopy play a role? How does that? So if we can touch upon that, I'm purely mentioning all those three in one go. So we are getting almost to the end of our show, unfortunately. So if our doctor can say a little bit about those aspects for the information for our viewers and for Natalie as well. Yeah.
So, no, I want to say one thing that, we learn all the technology from the West, but we apply it more aggressively than the West, unfortunately. I feel that many of the people I see from the West, they don't have access to treatment properly. Our people have a easier access because the cost of the treatment is much more lesser than what you have in the UK or the US or whatever. It's a really unfortunate. Sometimes I feel I should call all of them here and treat them in India. So we are very aggressive because you can't tell a person to keep on having children and having losses. You have to be more aggressive. So, you need to look for a structural problem. So it's very simple. You do a 3D ultrasound, and if you have a doubt, you put a scope in the uterine cavity. If there is a septum, you cut it. It's very easy. If there's a polyp, you just remove it. So we are very aggressive. If there's a fibroid, large fibroid more than 4 centimeters, even if it is not distorting the cavity, I'll take it out by laparoscopy. And it's very easily available in our country. Wherein in your country, it's very costly, unfortunately. Then I will look at the immunological aspect. If there's an immunology, I'll treat it. If there's a prolactin level, I'll treat it. If there's a hypothyroid, I'll treat it very aggressively. If there's a Apla syndrome, I'll give her aspirin and heparin. Now, after this, there are 50% where they are unexplained. So there's a lot of immunological causes, and there are certain immunological tests that we do. If there's an immunological test positive, we give them aspirin, heparin, and many people are giving them IV immunoglobulins or intralipids, which is a cheaper form of immunoglobulin. It's an alternative therapy. Whether all these things, what works, we don't know. It's very easy to make a patient who is not conceiving to make her pregnant is very easy. A person who recurrently pregnancy loses is more difficult because you can't pinpoint the cause. Ultimately, the ultimate solution is now pre-implantation genetic testing for aneuploidy. That means what? Because 80% of miscarriages are due to chromosomal disorder. So what we do is we do the IVF, take the eggs out, take the sperm, make the embryo, take a biopsy of the embryo, and analyze it for chromosomal disorders. Most of them are aneuploidy disorders. And we select the embryo which is not aneuploidic and implant it and get a pregnancy. It's so simple. You understand? So, and along with it, we supplement it with immunological problems as well. So we would supplement them with aspirin, heparin. Many of these are off-label empirical therapies, but they really work. And I get a lot. I've had patients with 8, 9, 10 miscarriages pregnant. So it really works. Now, this protocol, there's a lot of protocols in the West. Those are not there, unfortunately, in our country. So we can do things more aggressively and faster. That's why I feel bad, because I feel this is a major defect in the Western medicine, that a lot of people don't have access to care. In our country, there are so many private nursing homes, and a lot of middle class has access to care at a very reasonable cost. That is what I would say. And I would, had she come to me, I would 100% given her a pregnancy.
There you go, Natalie. Something to keep a contact with there, and maybe have a word with the doctor there. If I can go briefly to Fizza here, the psychological impact, Fizza, for a person going through, you know, trying again and again, you know, how do you think some people cope, or what kind of support do you think, you know, are they turning to, or do they have around them that they can turn to, either help them overcome some of the thoughts and feelings that they're going through, whether they should be able to say, okay, let's try one more time. What kind of, you know, psychological sides of things, you know, have you come across that, you know, should one, I mean, is this the right way for one to go about? And what sort of supports are out there, and what kind of support should they be reaching out for?
Yes, there are different therapies that can be utilized, but it depends upon the nature of the problems, the nature of the complaints the client is coming up with. For people who are experiencing overthinking, obsessions, post-traumatic stress disorder, it's better that they seek cognitive behavioral therapy (CBT) for that, along with if they are trying to conceive again. Apart from that, so that's particularly for those who experience overthinking, who are fearful, who have doubts. Then people who have marital issues or different, they're not able to keep up with the things in their lives. Supportive therapy is a thing. People dealing with grief who are not able to overcome that loss, grief therapy is recommended for them. Then people who are experiencing issues with their partners, marital therapy is recommended for them. So yeah, there are different therapies for the different kinds of problems that the person must be facing, but basic counseling works for all. So if if the client is not interested in seeking a therapy, or the partners are not supporting them, then brief counseling therapy sessions, even from good support from their family members, could be really helpful for them as well.
Yeah. So Natalie, is there anything that you would like to raise, or, you know, maybe ask our doctor or Fizza in relation to some of your experiences that you have shared with us, that you feel that for yourself, as well as maybe our viewers, can benefit from, you know, situations, you know, such as this?
I think the biggest thing is find the right support to help you, to speak to the right people to help you. And maybe if I had known 9 years ago to go to India and have more tests, that might have been something that I would have looked at. Um, I I just seemed to have hit a brick wall, and I didn't have the energy to move forward. So it'd definitely be worth, maybe if somebody's wanting to keep trying, is to look at different ways and maybe see what options you do have, and speak to this wonderful doctor who can maybe help. But it's getting the right support. Find the right support for you and for your relationship, because that is so important. And don't feel ashamed, and don't feel that you have to suffer in silence and keep this a secret, because it is not, it's nothing to be ashamed of. And it does happen, and it is more common than you would realize, than you would think. Reach out to people, and you will come across somebody who's experienced it, who might be able to help you, who's further down the road than you are. I didn't do that. I just bottled everything in, and it took me much longer to deal with the process. But the biggest thing is, don't feel ashamed. Just share it, and let's talk about it more, and just be more aware that this does happen.
Well, thank you for being really brave and sharing all of that with us. And we all get an insight about it, and I'm sure there are a lot of people out there who are having similar journeys as yourself. I'd like to ask our doctor as well. We are coming to the end of our show. If you can tell our viewers a little bit. I know you are a medical director and you are a specialist gynecologist, but also, if you can just tell us, what other areas that you actually involve yourself in relation to miscarriages, and what are some of the things that people can look out for and reach out for, and whether it's in the UK or India. I mean, from what you've said so far, it just seems like, I'm sure Natalie would agree, it would be perfect maybe for you, Natalie, to go and pay a visit to our Dr. Hrishikesh Pai, and because I can see already you're feeling, I can see a little glow in there, Natalie, that you're already feeling that, if only this doctor was nearby, maybe, there are some questions and things I could have put out. But if I can ask, Doctor, that if you can tell us what are the things that you actually do specialize in relation to the miscarriages, and what good advice or information can you give out to our viewers just to finish off?
So, I do a lot of IVF. I've been doing IVF for 30 years now, since 1991. And I would like to anecdotally tell you, when I was in my, 15, 18 years back, one person came from UK. She was in the police. She was an Indian. She said, Doc, I'm in the police and I've had 2-3 miscarriages. And that time I used to use a lot of heparin. I said, listen, this test for, and, Apla syndrome, many times they come wrong, and I would personally take a heparin injection next time you have a pregnancy. And then she went off to UK, and after 1.5 years she wrote an email to me saying that, doctor, I took your advice and I told my clinician, no, I want the daily heparin injection, and I have had a child now. So the problem is that there's a lot of people like me who do gut feeling medicine. There's a lot of, so if you go, there are a lot of people who say, no. There is no study which says that this is effective. But after 3-4 repeated abortions, there is a lot of gray zone areas, and people do try things which may or may not be effective. You understand? Because it's all a gray zone. So there are 3 main areas of recurrent pregnancy loss. There may be a problem with the embryo. So you do a genetic test and put a normal embryo back. There may be problem with the uterus. So you look for a abnormality in the uterus, or there may be a problem in the mother. So you look for a hormonal disorder, or you look for an immunological problem. The immunological tests are very big. There are a huge number of immunological problems that all contribute to this. The next 10 years would be to separate them into different compartments. We have not yet achieved that. So a lot of these things which we do, which are vague as per many standards, like giving a heparin daily injection, or giving an aspirin, or giving an intralipid, or giving an IVIG. One of my friends in Mumbai, he does LIT therapy, leukocyte immunotherapy. Again, very controversial. So these are all immunomodulators.
Yeah.
And giving a progesterone. So these are the areas which many doctors hesitate to give. They say, no. If you had not given it, she still would have had a child. But so that's the controversial area. So recurrent miscarriage is a major controversial area. Unlike IVF, if you don't conceive, it's very easy. But the ones who conceive and they don't continue the pregnancy, that's the challenge. But I feel that if you do them holistically, give them therapy, give them psychotherapy, treat them medically, and treat them aggressively, they achieve a pregnancy. You can't tell a person, okay, keep on trying. There's a study which shows, shows that if there are, they divided them into 2 parts. One was, they said you keep on trying. And the other part, they gave them medical treatment, and both of them achieved pregnancy ultimately. But it's not just achieving the pregnancy, it is achieving it in the earlier way. You can't keep on having miscarriages. You can't tell a person you keep on trying till you get a child. It's difficult for the person. Every miscarriage is a major trauma to that person.
Of course. And so it has to work side by side. Yes. Yeah.
The only thing now what we are doing is that we do it at a very low cost. That's the power. I'm so happy now because I can offer my skill, which is on par with the world. I've been doing.
You sound amazing, doctor. Honestly,
yeah, we need but I can do it at a low cost. That's the thrill of it. Yes, that's the fun of it. Today I've got the best. I've got an NGS DNA lab in my own lab. Not many IVF guys have that, even in England. their own lab. I own a DNA lab. But that's the power. Own that lab and then give it at a lower cost. That's the challenge.
Brilliant. Excellent. Yeah, amazing. Thank you very much for that, Doctor. Fizza, just very briefly, anything you would like to just finish off and share with us before we finish?
Yeah, I would like to add that support groups, psychological support groups are very important and they work wonders where people share their stories, their struggle. That's very motivating for the other people around. So we do have that for different, for cancer, patients suffering from cancers, from patients suffering from terminal diseases. I think we should have that social psychological group support for the people who experience miscarriages as well, and so that they can and share their problems with each other and share their success stories that might motivate the other people too. Yeah.
Thank you very much for that. Thank you very much to you all wonderful guests and giving your valuable time. And thank you very much, Natalie, for sharing your journey with us. I do hope our viewers have taken a few things on board and benefited. But I do hope to see you all again soon on my show with more, beautiful topics such as this. And let's create awareness together. So thank you again.
Thank you. Thank you.
Thank you. Okay, so viewers, we've seen and we've heard from not only our professionals but also from a very wonderful person who is able to share her journey about not one miscarriage but recurrent miscarriages. And what we've learned is that support is important, especially the support from the partner that you have. And also, not only do that support mean a lot to you, but finding out the different kinds of ways that you can help yourself mentally, emotionally, physically, they work hand in hand with some of that. We've also learned that do not feel ashamed, do talk to someone about it. Do not feel that that you've got to feel guilty, or you feel that you're exhausted now, you cannot try anymore. Find out not only from experts but from supportive people, families, partner around you. And miscarriages are not something that should be left unspoken. Like I said, and like our guests have mentioned, you need to talk about it and know that you are not alone. So on that note, stay safe and follow VodTalk.